Action.
Sorry about that. Okay, so we got the second dissection of the cow heart. First thing you notice is the round nature of the ventricle here. That would be the left ventricle. And the right ventricle, you have more of a lunar or C shape. The left ventricle generates a lot more pressure as it squeezes blood out of the aorta than the right ventricle, which is squeezing and ejecting blood out into the lungs through the pulmonary valve. Now looking at the top of the heart, you can easily tell which side of the heart you're looking at because the coordinate tendinate will project into the ventricle from the AV valves. And you see these tree-like projections in the atrium. Now you know this is the atrium because again you're at the top of the valves that have the coordinate tendinate. These tree-like projections are called pectinate muscle. Where would you find the papillary muscles? In the ventricles. What is one structure that you would expect to see in the right atrium? Besides the pectinate muscle, you would expect?
You see the tricuspid.
Oh, the big tree-looking thing.
The tricuspid valve, yeah. What about the coronary sinus? No, you guys don't see the coronary sinus in the atriums?
Oh, it's
on the
yes.
outside.
Remember the venous blood of the myocardium drains into the coronary sinus? We have a nice coronary artery there. A couple coronary arteries inside the interventricular septum. One thing you notice about this heart compared to other ones, you see the thickness of the left wall is comparable to the thickness of the right wall. This is not normal. Usually the right ventricle wall is much skinnier than the left ventricle wall. This cow might have had a disease of the lung where it needed more pressure on the right side to pump blood into the lungs. We have another example here where you have a cow that has actually a very large intraventricular septum compared to the ventricular wall, the left ventricular wall. This is also a common disease that you see in kids. This is like, if you ever hear a story about like a basketball player in high school that just dropped dead during practice or a game, it's usually because they have a hypertrophic intraventricular septum. The problem with this being too thick, it actually blocks the semilunar valve, the aortic valve, from functioning properly. And it can impinge on the coronary arteries. So, 17-year-old having a heart attack, you would think that.
So what was in the fat again with the arteries? What was that?
Well, we don't have the pericardium here. The pericardium has been removed, but we have the coronary arteries here. And this fat is heavily calcified. I mean, it's like a rock. I think that's all the structures we can go over in this